Talking about some numbers today and mental health. The United States dealing with a mental health crisis among teenagers, and the pandemic certainly has made matters worse. A new CDC study found that 44% of high school students say they feel persistent feelings of sadness or hopelessness. 44% is high, especially when you consider the number was 26% in 2009.
And ER visits for psychiatric emergencies are also on the rise everywhere. So why is this happening? We're bringing in our parenting expert, Dr. Cheryl Ziegler, to talk about this. And it's hard to pinpoint one thing, Dr. Ziegler, but why are we seeing this increase?
Yeah, I mean, first thing I want to point out is May is Mental Health Awareness Month, and this is a great time to really slow down and think about what is the mental health of your teenager. This is happening for a couple different reasons. You mentioned some really good stats. I think, we're just trending worse and worse by the year with teenage depression over the last 10 years, particularly lots of different, gender and races are really showing different trends. Everything's getting worse, though. So in every category, things are just getting worse. So 1 in 4 girls, have seriously contemplated suicide. If they identify as LGBTQ plus at all, you can take that as 1 in 2. And we are looking at, race disparities, like I said, but with even Caucasians really being on the rise as well. There's really nobody that's really safe from this. So this is happening for a couple of reasons. One being social media. So we know that kids were on screens more. That's been a trend over the last 10 years. Of course, the pandemic, that exacerbated things. So the constant images and being on there and the FOMO is really decreasing kids' their self-esteem and increasing their anxiety, feelings of depression, and even suicide. The other things that are happening is that we see a decrease in real life hanging out, just socialization. And so when you have that, you have this whole other sort of virtual world that doesn't align. That's adding to depression as well. And I would say the last thing is really, news and media, that there's a lot going on in the world, and these kids have access on every single platform possible. They get their news even primarily from TikTok. So they don't really have a shield from it. So it's a lot of overexposure.
Yeah, you think of the silo that's created by a pandemic and by what social media can do as far as, like you talked about, real life hanging out, and you get isolated. But also your near environment, I think the mental health stress on parents as well, on siblings, all of that comes to bear as well on each individual, that when people around you are struggling or having a tough time, that reverberates.
Absolutely. We all function in systems, and our whole system. So if we just even focus on Colorado, we are in a pediatric mental health state of emergency, something that hasn't ever been called in the 118 or 20-year history. So we are struggling really as a community. This is not just isolated. I think that's a really good point. And I think that parents also, when we get scared, parents tend to want to get even more protective. And what we know is when we look at the protective factors, though, of resiliency, we want kids to be able to learn how to problem solve and to not be shielded from everything and have just the right amount, give or take here and there, of conflict, of stress, of struggle, and teach them, support them to go through it, but don't shield them from going through it.
All of the things we need to continually talk about and raise awareness about. So thank you, especially in this month of May. Thank you, Dr. Ziegler.
Thank you.